Hi everyone. Today let us talk about the tuning fork test part 2. In this we'll be talking about the Weber's test, absolute bone conduction test, Showbox test, Bing test and Gele's test. Coming to Weber's test. How do we perform the Weber's test? We take a vibrating tuning fork and we place it in the midline. Whether we place it in the vertex or we place it in the middle of the forehead or we place it on the incisor teeth. And we ask the patient whether he can hear this vibrating tuning fork sound equally on both the sides or whether it is lateralized to the right side or the left side. So this is what we are going to tell the patient and ask the patient to tell whether it is heard better on one side or is it heard equally on both the sides. Please note that we are checking the bone conduction only. When we are placing the tuning fork on the bone, obviously we are testing only for the bone conduction. We are not placing the tuning fork in front of the pinna. We are not testing for the air conduction at all. What are we trying to do? We are trying to test the bone conduction and conduction on the two sides. We are comparing whether the right side is better than left side or the left side is better than right side. Okay, if the tuning fork is heard equally on both the sides, we say it is normal, or we say the Weber is centralized, or Weber is central, which means it is heard equally on both the sides. Okay, so what happens if in a case of sensorineural hearing loss? What happens to the Weber's test? Yeah, we take the vibrating tuning fork and place it in the center, and what happens? We suppose there is a right-sided sensorineural hearing loss. The right-sided cochlea has got damaged by some degree. Okay, right-sided cochlea has got damaged by some degree. So he will hear less on the right side, and he will hear normally on the left side. So the right side is heard lower, left side is heard normally. So the Weber will be lateralized to the left side, or in other words we say that the Weber is lateralized to the opposite ear in sensorineural hearing loss. Why? As we already said, the right-sided cochlea or the sensorineural pathway has got damaged, so it cannot hear it as well as the left side. So Weber is lateralized to the left or the opposite ear or the normal ear in sensorineural hearing loss. Now to just put some numbers and to make it more easily understandable, we take a vibrating tuning fork and we place it in the center. We imagine that this person is having a sensorineural deafness of 20 units. So what happens? The cochlea's capacity to transmit the sound has decreased by 20 units. Okay, that is understandable. Now I want to bring a concept of ambient noise also. Ambient noise, any person's in any surroundings, there is always this ambient noise, and this ambient noise is passing through the air conduction pathway, that is the external auditory canal, pinna, tympanic membrane, ossicles, and this ambient noise is always interfering with the sensorineural pathway. Okay, so there is this interference that is always present, and we always consider this interference as normal. Okay, so there is the capacity of the tuning fork to be heard is decreased by 20 units all the time, wherever it is, in the normal settings. But on the left side, in addition to the ambient noise interfering with the sound, the sensorineural component, that is the capacity of the cochlea to transmit sound, is also decreased by 20 units. The total deafness on this is 40 units, and this tuning fork is 60 units. So 60 minus 40, the brain perceives the sound coming on the left side cochlea as 20 units, and on the right side only there is ambient noise and the cochlea is functioning normally. So the decrease in that cochlea in this tuning fork is only 20 units. So 40 units of sound is perceived on the right side. So the normal side is better than on the left side. So Weber is lateralized to the normal ear or the right side. There is deafness in the left ear, but the Weber is lateralized to the opposite ear. So we say Weber is lateralized to the opposite side in sensorineural hearing loss. Okay. Now what happens in conductive deafness? Weber is lateralized to the worst ear. The problem where the problem is there on the left side, on the worst side, the bone conduction is heard better in the worst ear. Why does this happen? As we already said, we have already gone through this topic. The ambient noise which is coming to the air conduction route, which always also goes through the sensorineural pathway, interferes with the sensorineural or the bone conduction pathway. This interference is absent in conductive hearing loss. So bone conduction is better in an ear with conductive hearing loss. Okay, so now coming to the example. Now this patient is having left-sided conductive deafness. So there is, suppose there is a fluid in the middle ear, there is serous otitis media. So what happens to the ambient noise? Ambient noise is coming, but because of the fluid in the middle ear, this ambient noise will not be able to transmit to the cochlea on the left side, because this conductive component, conductive pathology is blocking the ambient noise. Okay, so whatever tuning fork you are placing it, whatever amount of units, that is heard as it is on the left side. So on the left side, the cochlea perceives it as 60 units because the cochlea is not getting disturbed by the ambient noise. On the right side, however, there is this cochlea and there is this middle ear which is functioning normally. So that 20 units will pass through the middle ear and it will interfere with the cochlea on the right side, causing the capacity of the cochlea to decrease by 20 units. Tentatively, like we imagine it, for example. So 60 minus 20 is 40 units on the right side. On the left side, the entire 60 units is heard because there is no ambient noise. So it is heard better on the left side. So what do we say? In Weber is lateralized to the worst ear. The problem where the ear where there is a problem, Weber is lateralized to worst ear in conductive hearing loss. Okay. I hope I have tried to make it understandable, but we need a mnemonic. Sometimes, in cases of stress, we may forget it, or till we get the concept, this will help. We create best students. So we create best students. Weber is lateralized to the worst ear in conductive deafness. Weber is lateralized to the worst ear in conductive deafness. But Weber, best students. Weber is lateralized to the better ear in sensorineural hearing loss. Weber is lateralized to the better ear in sensorineural hearing. Worst ear, Weber is lateralized to the worst ear in conductive deafness. Weber is lateralized to the better ear in sensorineural deafness. Now, coming to absolute bone conduction test. Absolute bone conduction test, as the name implies, it is testing only or absolutely the bone conduction. That is a sensorineural deafness only. What is the principle of this test? How we do with this test? We compare the bone conduction of the patient with the examiner, considering the examiner's hearing to be normal. We are comparing the bone conduction, that is the sensorineural pathway of the patient, as compared to the examiner. How do we do it? External auditory canal of both the examiner and the patient is occluded. We close the external auditory canal of both the patient and the examiner, and then we place the tuning fork on the mastoid. We place it first on the patient's mastoid, and we tell the patient, once you stop hearing it, you tell me. Once he stops hearing it, you place it on the examiner's mastoid, and the examiner still hears it, then means that the bone conduction of the patient is decreased as compared to the examiner. That means patient is having sensorineural hearing loss. Okay, what is the objective of occluding the examiner, external auditory canal of examiner and the patient? We are preventing ambient noise through the air conduction route. So we want to test only the bone conduction. We don't want to get disturbed by what is happening in the conductive pathway. So we are testing absolutely the bone conduction. In this, we are placing the tuning fork on the patient's mastoid, and once he stops hearing it, you place it on the examiner's mastoid. If the examiner still hears it, then the patient is having sensorineural hearing loss. Okay, the examiner still, the patient is having sensorineural. This is what I said. Result. How do we say the result? The absolute bone conduction of the patient is shortened compared to the examiner in sensorineural hearing loss. In conductive deafness, patient and the examiner will hear the fork for the same time, because by pressing the external auditory canal, we are removing the conductive component out of the way. In normal, it is same as that of the examiner. In conductive deafness, also it is the same as the examiner. That is what is we try to tell by absolute bone conduction test. We are testing absolutely or only the bone conduction of the patient. That is, we want to diagnose sensorineural hearing loss in this patient. If the patient, we are suspecting the patient is having sensorineural hearing loss, Then you close the external auditory canal of the patient, and you close the external auditory canal of the examiner, place it on the mastoid of the patient. If the patient stops hearing it, you put it on your on the examiner's mastoid. If you still hear it, you are confirming that the patient is having sensorineural hearing. Coming to Showbox test. Showbox test is nothing but absolute bone conduction test, but we are not keeping the external auditory canal closed. We are keeping the external auditory canal open so that we can test the air conduction also. Same as that, we tell the patient, we are going to place a tuning fork on your mastoid, and once you stop hearing, you tell me. If the bone conduction is shortened, sensorineural pathway is affected, the same as that of the absolute bone conduction test. If the patient stops hearing, you can hear it after the patient stops hearing. Then the bone conduction of the patient is shortened as compared to the examiner. So the patient is having sensorineural hearing loss. If the bone conduction is same as the examiner, that is, you place the tuning fork on the patient's mastoid and he stops hearing, and after that you place it on your mastoid, you also can't hear anything. That means it is the same as that of the examiner. The bone conduction of the patient is the same as the examiner. That means both are, the hearing is as compared to the examiner's, and the patient's hearing is normal. If the other way of looking at it, the patient is hears for a longer time as compared to the examiner, then the patient is having conductive hearing loss. So this time you reverse it. You place it first, and then you are suspecting the patient is having conductive hearing loss. You place it first, and then you place it on the patient. After you stop hearing, you place it on the patient, and the patient can still hear it. Then the patient is having conductive hearing loss. Why his bone conduction has improved compared to the examiner? Because in conductive hearing loss, the ambient noise is not there in this patient with conductive hearing deafness, is not there to interfere with his sensorineural pathway. We are testing only the bone conduction. We are testing only the sensorineural component. We are not testing the air conduction component. But in this patient with conductive deafness, his neural pathway interfered by the ambient noise, so he can hear for a more period of time compared to the examiner. I hope I am clear. This is a complicated topic, so I'll just repeat it once again. So Showbox test is the same as that of absolute bone conduction test, except that the external auditory canal is kept open. Patient stops hearing, you can still hear it, examiner can still hear it. It means that the bone conduction is shortened compared to the examiner. It is sensorineural deafness. Same as that of examiner. Okay, that is normal. Okay. Now in conductive deafness of the patient, there is no ambient noise to disturb the sensorineural pathway. This ambient noise is there to disturb the sensorineural pathway of the examiner. So because in conductive deafness, the patient can hear for a longer period of time compared to the examiner. Okay. So how do you say the result? Showbox is shortened in sensorineural deafness. Showbox is lengthened in conductive deafness because of the ambient noise. So what is the mnemonic to remember the Showbox test? Students, let's conclude and study summary. Students, Showbox test is let's conclude, lengthened in conductive deafness. Has shortened in sensorineural deafness. Showbox is shortened in sensorineural deafness. Students, let's conclude. Matlab, Showbox test is lengthened in conductive deafness and it is shortened in sensorineural deafness. Okay. Now coming to Bing test. In Bing test, we are again testing only the bone conduction. We are again taking a vibrating tuning fork and placing it only on the mat. And we are alternatively keeping the external auditory canal open, and we are closing it. We are opening it and we are closing it. Okay. We are opening it. We are alternatively keeping it open and closed. That is, we are adding both absolute bone conduction and Showbox. Okay. But alternate. And we ask the patient, can you hear better if it is open or can closed? Okay. Okay. So we are only examining the effect of occlusion of the ear canal on hearing. Okay. What is the result? How does it appear? Bing positive. Always remember, Bing positive is the same as Rini positive. Okay. That's how you can remember. How is Rini positive? There are two possibilities we said. Okay. In normal and in sensorineural hearing loss. So Bing is positive, louder if external auditory canal is occluded. If you occlude the ear, you can hear it louder. That is positive. Positive means louder. It is seen in normal hearing and sensorineural deafness. Okay. So why is it happening? Why is this Bing is positive if the external auditory canal is occluded? When the external auditory canal is occluded, the ambient noise is not there. Ambient noise is blocked. Ambient noise is not going to interfere with the sensorineural pathway. That is what we are testing. We are testing only the bone conduction. That is, we are testing only the sensorineural pathway. When we occlude it, the ambient noise is not there. So you can hear the bone's conduction sound better. It happens in normal and sensorineural hearing loss. We are not comparing the right side with the left side. We are only comparing in the same ear. That is how you have to remember it. It is the same ear we are testing, and we are just what is the effect of occlusion of the external auditory canal on hearing. Once you occlude it, you can hear louder, which means that the patient's hearing is normal or the patient has sensorineural hearing loss. The concept is the ambient noise is not there when you occlude the external auditory canal to interfere with the sensorineural pathway. Okay. Bing is negative. Bing is negative means sound does not decrease. Sound is, there is no change in hearing on external auditory canal occlusion seen in conductive hearing loss. Same as Rini negative. Rini negative is seen in conductive hearing loss, right? And also in sensorineural hearing loss on one side. Now that we will not go here. Severe sensorineural hearing loss on one side. Okay, we will not go there. We will just say that there is no change in hearing on occlusion of the external auditory canal. That means Rini Bing is negative. It happens in conductive hearing loss. What is the explanation? In conductive hearing loss, whether you keep the external auditory canal open or whether you keep the external auditory canal closed, it is already blocked. Ambient noise is already not making any change. We are only testing by closing the external auditory canal. Does the ambient noise make by removing the ambient noise factor? Do we make any change in the hearing? In normal and sensorineural hearing loss, when there is no ambient noise, your hearing will improve. That means Bing is positive, you can hear louder. But in a patient with conductive hearing loss, what is happening? The ambient noise was what was there before, after occlusion of the will be the same. So there is no change in hearing. So conductive hearing loss, already the air conduction is blocked. So blocking will have no effect. So that is the explanation for Bing negative. Like Rini, Bing is like Rini negative in CHL, Bing is also negative in conductive hearing loss. So how do we compare with other things? In Weber, we are comparing the bone conduction and we are comparing with the right side and left side. We are comparing the 2 ears, comparing with the other ear in Weber's test. In Showbox, we are comparing it with the examiner. We are comparing only one ear, either right or left ear. We are not comparing right and left, right with the left in absolute bone conduction in Showbox. We are testing it with the examiner. Okay. And in Rini, we are comparing the air conduction with the bone conduction. Here, we are not comparing it with the other ear as in Weber. We are not comparing as with the examiner as in absolute bone conduction and Showbox. We are not comparing with air conduction as with Rini. We are just comparing the effect of blocking the external auditory canal on bone conduction. So bone conduction we are testing, and we are only seeing if we can keep the external auditory canal open or keep the external auditory canal closed, what is the effect. If on closing, if we hear it louder, we say Bing positive, seen in normal and sensorineural hearing loss. Keeping the external auditory canal, there is no change in the hearing. There is no change in the hearing when you keep the external auditory canal open or closed, seen in conductive hearing loss, because ambient noise is already blocked in conductive hearing loss. Now coming to Gele's test. Gele's test, let me tell you why we are trying to do Gele's test. First, before we start doing Gele's test. Gele's test is a historical thing, but this is asked. This is a favorite examiner question. It has been asked in the theory exam and also one of the favorite questions in NEET PG. Very easy to confuse the students. In fact, anyone you can easily confuse with Gele's test. Okay. So this was a popular test when we had to rule out stapes fixation before tympanometry came into effect. Before we started doing tympanometry, when tympanometry was not there, you wanted to find out whether it is otosclerosis, whether the patient is having otosclerosis or not. To do that, we were doing Gele's test. Okay, so what is the principle behind Gele's test? This is also a test of bone conduction. Now we know all the tests now. Except Rini, all tests, Weber's, absolute bone conduction, Showbox, Bing and Gele's, all are testing only the bone conduction only. Okay, that is we are placing the tuning fork on the bone, on the mastoid or in the middle of the forehead, somewhere. Okay, examines the effect of increased air pressure on hearing. Now this is the funny part. Now, increased air pressure in external auditory canal and hearing. So we take a Siegel speculum, we put it snugly in the external auditory canal, and we press the Siegel speculum. We increase the pressure in the external auditory canal with the help of a Siegel speculum. What happens when we increase the pressure in the external auditory canal with the Siegel speculum? It pushes the tympanic membrane and the ossicles inwards. Okay, this is understandable. Tympanic membrane is pushed inwards, ossicles is pushing inwards. So what that happens? It raises the intralabyrinthine pressure. It raises the intralabyrinthine pressure. Okay, it increases the pressure in the scala vestibuli and scala tympani. Okay, so once it increases the pressure in these things, the basilar membrane gets immobilized because of this pressure. This pressure is transmitted through increasing the interlabyrinthine pressure. We are immobilizing the basilar membrane, and that causes decrease in hearing. And when that happens, it's called Gele's positive. Gele's positive is normal. Bing positive is normal. Rini is positive is normal. All these are normal only. Okay. So in a normal patient, in a normal person, when you increase the pressure in the external auditory canal, it pushes the tympanic membrane and the ossicle inwards. It raises the interlabyrinthine pressure and it causes immobility of the basilar membrane. Thereby, it causes decreased hearing. Hearing is decreased. Hearing is decreased means it is good. Means everything is working functionally. Everything is working normally. Okay, this is called Gele's positive. It is seen in normal people. Okay, now Gele's negative, or there is no change in hearing. Same thing in Bing also we can there is no change in the hearing when you occlude the external auditory canal. When you occlude the external auditory canal, there is no change in hearing. That means it is Gele's negative. No change in external auditory canal. On external auditory canal occlusion is Bing negative. No change in hearing when you increase the air pressure. Seen in Gele's negative, it indicates ossicular chain fixation. So what happens? You increase the pressure in the external auditory canal. Siegel speculum. In otosclerosis, this pressure is not transmitted to the labyrinth. So and in stapes fixation, because of stapes fixation, whatever the increase in the pressure because of this stapes getting fixed by the otosclerotic focus, that increase in pressure is not transmitted to the intralabyrinthine fluids, and there is no immobility of the basilar membrane. There is no decrease in hearing when you increase the pressure in the external auditory canal. So there is no change in hearing when you increase the external auditory canal pressure with the help of a Siegel speculum. Indicates that the patient is having some kind of ossicular fixation or ossicular immobility or discontinuity. So you're not able to put the pressure into the interlabyrinthine fluid, causing decrease in hearing. So no change in hearing is that there is a problem. No change in hearing indicates that there is a problem, and that says that Gele's is negative. Yeah, same as Rini is negative. I don't think you can compare with Rini here. You can compare with Bing negative. Bing negative, no change, conductive hearing loss. I don't think you can compare with Bing also. You cannot compare Gele's negative with anything actually. You can compare Gele's positive with Bing positive and Rini's positive, but you cannot compare Gele's negative. Gele's negative, the patient is having ossicular fixation, and that indicates otosclerosis. This was a popular test before the advent of tympanometry. Yeah, thank you. I hope I have not confused you more than you were already confused.